Now, what is the classification? So the classification most famously was given by Andersons and D. Alonso, the type 1 injury pattern, type 2 and type 3. So there are different injury patterns that were given. There are different patterns that were given on the basis of how the injury has happened. So type 1 injury basically is the oblique fracture of the tip, basically, which happens when there is an alar ligament rupture. You have to rule out atlantoaxial instability because generally the treatment is basically determined on the basis of the instability. Type 2 fracture is a fracture that happens through the waist of the odontoid right over here. This particular fracture is the fracture which has got a high rate of non-union, as we discussed. So why and when does the non-union rate increase? So the non-union rate increases whenever there is a more than 5 millimeters of displacement. There is an angulation of more than 10 degrees. When the age of the patient is more than 40 years and when there is a significant posterior displacement. So I'm repeating, which are the fracture patterns which are generally having a tendency of going into non-union when there is a more than 5 millimeters of displacement, when the angulation is more than 10 degrees, when the age is more than 40 degrees, and when there is a significant posterior displacement. So 5 millimeters, more than 5 millimeters of displacement, the angulation more than 10 degrees, age higher than 40, and posterior displacement. So these are notorious to go into non-union. Type 3 fractures are the fractures which extend into the body of the axis as well, as it is shown over here.